Hello, my name is Sandeep Kahir. I'm here at Satya clinic today to get my hair transplant. I met Dr. Shaiil Gupta 10 years ago when I got my first hair transplant. At the time, I was researching to find a reliable clinic and a trustworthy doctor for hair transplant, and there were very few at the time, a few quality clinics at the time. I was taking all the medications, but none of them were helping me. So I met Dr. Shaiil, and he recommended me to go with FUE technique, which was new at the time, and I got 2500 grafts. The results were amazing. I got a great hairline, as you can see. After 10 years, it's still intact, and also the medication I started taking after the transplant was kind of monitored by Dr. Shaiil Gupta. So it definitely helped me to get great results. He is very passionate about his work, and his team is very dedicated and empathetic towards all the patients, and I certainly felt that during my first transplant. Today, after 10 years, I'm here again. Dr. Shaiil Gupta recommended me to go with FUE technique, and today I'm getting 1800 grafts to fill the gaps and kind of get more density on my head. So I'm really looking forward to the surgery today, and I'm glad that Dr. Shaiil Gupta still has, after 10 years and after such a great success and great journey, he still is very passionate about what he does and very empathetic towards his patients. So really looking forward to the surgery today.
How many sessions of PRP did you get done?
Yeah, I got I started 18 months ago only. So
Okay.
since I got the surgery here in 2014, I think my last PRP was in 2018 from here. And then after 2018, when I started noticing some thinning, that's when I started with the PRP, which was early 2023. So I got 4-5 sessions last year, just to kind of
in Canada.
Just to kind of slow down the fall and thinning. But then I realized I need to, when I go back, I need to meet you just to kind of put things in order. But yeah, in between 2018 and 2023, no PRP, just the medicine. And it was, to be honest, it was all okay. I thought it was going very well. I mean, and of course, with age, I understand. With age, eventually,
Yes.
my natural hair will fall. But yeah, no, it went really well. And kind of to the point you were making earlier, having lived through the surgery for 10 years, it's not a quick fix kind of solution.
Yes.
So it is long term. And what you and your team are doing is life changing. So I mean, you should all be very proud, but there is, as you mentioned, such an immense responsibility on you guys to make sure that journey of the patient. So and that's the reason perhaps why I'm returning to you, because I mean, all that guidance you gave me over the period definitely helped me to stay healthy.
Yeah.
With no side effects, thankfully, and yeah, that's so important. So I'm glad that you acknowledge all those things. As I said, I mean, it's not like you get the surgery done and 6 months you're done. It's not like that. It's long term. Those effects they stay for long.
They just stay for long, and we have to actually plan the journey, and yeah, these days what's happening, a lot of people come to me for repair transplants, and in less than 1 year we see their result is gone. I mean, we don't see hair. It looked smashing when for 1 year, but then it's gone, and the poor chap doesn't even understand what has happened. He starts blaming himself, saying that, oh, probably, I did something wrong. Many a times he says, okay, the clinics tell him that, you did not go for those sessions of PRP, so probably your fault. We had grown those hair, and it was really good. You cannot blame us now because look at the 6 months pictures, look at the 1 year or 11 months pictures. You look very full, and these guys, they give testimonies sitting on their sofas, and very happily, okay, doctor is great and he did wonderful job, but he did not know that the result he was thinking as a testimony to the surgeon's skill was not the pure transplant. It was almost 90% medicine and 10% surgery. So as soon as, and unfortunately, most of the times these patients are not even aware of how to manage the medicines. I mean, how to make sure that the medicine's effect stays there for long. They abruptly stop it because half information is given. Someone tells them, okay, take it for 6 months, we will stop, then we will slow down or we'll reduce or something like that. Sometimes, and most of the times, they are given straight away full doses of medicine, although 1/5, 1/6, 1/10 of the dose also is known to give you benefits. So again, then this is a problem, big problem these days. Any pain here?
No,
Good.
all good.
So the surgery which you underwent 10 years back, it was equally painless, or
Yeah, it was all painless. Yeah, I
All
never
painless.
felt- yeah, even after that, no swelling. So
last time?
no, yeah, exactly.
Although in last 10 years we have worked so much on the technique that the things have more or less changed completely.
Yeah.
Now what we are doing is I can say 10 times better than what we were doing that time. Although your case, I mean, even then we were giving like good results. You are happy with the results which you got 10 years back?
Yeah, very happy, very happy. Yeah.
So many of the male patients also these days, they request not to cut or shave off the hair so that they can resume the work as soon as possible. So if we find it feasible, we do it, and it really helps them. In fact, when I did my transplant, I also I also did a non-shaven thing for myself as well.
Okay.
So yeah, so that actually helps. So now we are making slits in between, and although your hair look pretty good even now, so on the right side here we are just going for an enhancement, and some areas where we did small numbers, eventually you have lost some hair in those zones over a period of time. We are just going to reinforce those areas. So it will be fun, and you will have again a good time
Yeah.
with these hair.
For sure.